everyone. I'm Maeve de France, Information Management Project Manager at CartONG. And I'd like to welcome both all of our speakers here today for the session and also all of the audience for this dedicated experience sharing evening session on how can humanitarian data practices come out of the pandemic stronger. So I hope you found this first day interesting and that you still have a bit of energy for this last session. So as usual on the practical side, you know, you have the chat box if you want to share some information or suggestions, and also the Q&A that we'll keep for the end of this session, which will last around 20 minutes with all of the speakers. And as Marion was explaining and might add elements in the chat on, we also have some poll questions that you'll be seeing on the Adventure side. And there's already one normally that's active. And I can see that we have people that have started filling it in on where you're joining us from. Also, feel free to tweet and share this discussion if you want to. So just to summarize the context and explain why we're having this discussion today. So as you're all, I think, very vividly aware, there's been no crisis since World War II that's had more extensive and across the board impact on the sector as this current pandemic. And the big question of accessing territories is the big one that we're tackling by, you know, through a lot of the questions that we're having today. And this question of access is something that has actually occurred in many different crises in the past relatively frequently, but usually associated rather to very localized events like earthquakes or typhoons, as we've seen, unfortunately, just this past weekend, or else political unrest and security situations in the field, such as in Sahel or Myanmar at the moment, or else more regional sanitary crisis like we've known in the last decade. But in this current pandemic, this difficulty of access is actually coupled with the need of NGOs to restructure their ongoing activities completely, build activities in accordance with new humanitarian situations that emerged as basically indirect consequences of this pandemic. And on top of that, huge HR internal disruptions for NGOs, as well as strategic and ethical decision-making that needs to be made. So I think we're all aware it's a very difficult situation to tackle for sure. And we're going to look at this in the angle of data today. So in terms of the current context, adapting the associated practices that NGOs have by in particular drastically reducing traditional face-to-face interviews and field exchanges with communities that the aid sector is used to, requires thinking through a lot of the choices that are made by organizations without just transposing old patterns to new situations. And as Ben Parker was reminding us this morning, data has a more and more important responsibility in the management of humanitarian crises. And we can add also to the prioritizing of a humanitarian crisis. And we as data practitioners need to remind ourselves constantly that it's not all about technology and being data driven, but also about how relevant our data is, if it is or not being used, and how and for what it's being used. So this session today really aims at taking a step back to better understand the challenges we have been facing, looking into the solutions that have been found at this stage, and also learnings that we've had to be able to share this more widely with the sector. So I'll just hand over now to Claire, who will explain why we've chosen to have only humanitarian to humanitarian actors intervening today. And Claire is the COVID-19 program coordinator for the H2H Network. So over to you, Claire.
Hi, and thank you, Maeve. Hopefully you can hear me loud and clear. So my name is Claire and I'm working for H2H Network. I'm part of the H2H core team, and as Maeve said, I'm coordinating our latest technical package in support to C-19 response. So H2H, in a nutshell, for those who are not yet familiar with this abbreviation, stands for humanitarian to humanitarian. And as H2H Network, we bring together more than 60 organizations that are delivering those humanitarian to humanitarian services. The network has been developed in 2016. We're currently supported by UK FCDO. And collectively, what we want to address is to fill a critical technical gap in the sector to make the response to crisis better and stronger. So to this end, we're making highly technical and specialized services available to humanitarians at all levels. How did we support the COVID-19 response to date as a network? Well, since February and right from the onset, actually within a week of the international community declaring COVID-19 as health emergency, we've triggered 2 activations. So which means in our H2H jargon that we developed bespoke menus of technical services and funded 18 different service providers in support of COVID-19 response. So first activation had a very specific target objective. It was to tackle the infodemic. And the second one, which started last May, is bringing together 14 different H2H organizations. It's still ongoing, and it has a broader scope, which is to support both global yet local efforts to fight the pandemic. So to give you a bit of concrete angle on that, examples of H2H technical support in this pandemic are, for example, direct and free information management support that comes in the form of data analysis products or mapping support. But responders, both international and local responders, can also access highly contextualized trainings or critical guidance on humanitarian standards with an objective to quickly and effectively adapt to COVID-19 and new realities. So overall, what I wanted to share as a quick intro is to really stress that H2H standpoint on the response is very unique, it's valuable, with organizations supporting, yes, frontline workers, but also assisting mostly remotely or through local partners. So I see there space for particular perspective, unique perspective, observation and reflection. So since February, since we activated to support the response globally and locally, we are developing with our members granular and really grounded understanding of what it takes to make our support better and make the response to the pandemic stronger ultimately. So we're starting to produce and make resources available to the sector, but this session today is really a good timing for us to share emerging learnings around data practices in particular. So to this end, I'm really delighted to introduce our 4 speakers. They're all parts of H2H organizations and having provided direct technical support in this pandemic. So welcome to all 4 speakers. Candice Holt, you are the lead analyst for ACAPS in Cox's Bazar, and I know you've been based there since last October. Hello and welcome. Eric DeLuca, you are Monitoring, Evaluation and Learning Manager for Translators Without Borders. We've got Christina Wille, you are Director and Founding Member at Insecurity Insights. And last but not least, Maeve Sattler, you are Director at Ground Truth Solutions. So thank you all for joining. And before we jump into the core topic of this session, which is really your practical experience of the crisis and the different solutions that you've put in place, I'd like us to first pause there and set the scene together for this conversation by reminding our audience the key challenges that you've observed in your daily work in terms of data practices. So Candice, Eric, Christina and Meg, and ideally in this order, it would be great if you could please kick us off briefly, sharing first the type of H2H assistance that you've been providing, that you are providing to support COVID-19 response, but also one key challenge or one key type of challenge that you've observed in your daily work in terms of data practices. So I'll pass to Candice, and please over to you, Candice.
Hi everyone, and thanks for that, Claire. As Claire mentioned, my name is Candice and I'm the lead analyst with ACAPS based in Cox's Bazar. The ACAPS Analysis Hub here is hosted by IOM's Needs and Population Monitoring Unit. And during the COVID-19 response, which is still ongoing, we supported humanitarians to make evidence-based decisions by providing technical support in research design and helping actors adapt their methodology to the changing situation. We also provided data analysis support, and as an analysis hub, we also produced our own thematic products, capitalizing on the various secondary data available to create a more comprehensive picture of the situation. So here in Cox's Bazar, obviously primary data collection has been really challenging. Since the 25th of March, the government of Bangladesh suspended all non-essential humanitarian activities and reduced the humanitarian access by 80%. This meant that all regular data collection using external staff stopped and created an overwhelming need for information that helped link decision makers with the affected population. So there was a really big need to switch to remote mobile data collection, but responders, and I felt like we experienced this as well, soon realized that that's not necessarily conducive to the context of the camps. And given time, I'm just going to go over two of the major challenges that kind of fed into why remote mobile data collection is a major challenge here. Firstly, sampling. So the telecommunication ban, which prohibited Rohingya ownership of phones, was only lifted in April, just after the containment measures. And this meant the response was not only inexperienced using remote mobile data collection, but also lacked the mobile phone database that would allow for remote and representative sampling. And it also meant that households had a low mobile phone ownership. And with the mobile phone ownership, the sampling sizes they were producing were more likely to be men and more likely to be households with a higher socioeconomic and education status. There were many attempts to try and get around this to build a database using snowball sampling, but this was also challenging given the high levels of distrust in the Rohingya population and their unwillingness to communicate personal information over the phone and to share phone numbers of their community members. The other major challenge was the types of information that can be collected. Language barriers and phone literacy meant that more complex assessments couldn't be conducted using this method, and they had to keep questionnaires really short and sharp. For more sensitive and specific perception questions, this seemed to elicit higher levels of response bias. For example, many actors through mobile data collection asked various questions on health-seeking behaviour to try and find out if people would visit the health clinics or if given a mask, were people wearing it. And many of these assessments through mobile phone data collection found, yes, 80% to 90%, everyone's going to the clinics and everyone's wearing their mask. But in reality, that wasn't the case. Clinics themselves report consistently low consultation rates and struggling to get people to test. And when you go into the camps, there is really limited mask wearing despite people owning this. Face-to-face, small-scale qualitative data collection exercises were able to help explain some of these perceptions and the behaviours being seen in the camps, though this data collection was also really challenging because actors had to rely mainly on programming staff whose role wasn't data collection, and that access to the population was limited to where those programming staff were based. I'm going to leave it there because I realize that I may have gone over time, but I think the major overall challenge here wasn't just being able to collect data and present it back, was collecting data that helped accurately reflect the situation in the camps. I'm gonna stop there for now.
And I'm gonna now ask Eric.
Yeah, perfect. Thanks so much. So I work with Translators Without Borders. For those of you who don't know, we're a specialized organization focusing on language support and helping to ensure that people have access to information and can communicate in a language and format that they understand. So during the COVID response, we've obviously been doing a significant amount of translation work, traditional written translation. We've also been we developed a terminology database glossary in, I think, close to 50 languages now that has over 200 different specialized terms, things like social distancing that to a lot of us were completely foreign concepts before this crisis started, don't translate very well into languages like Swahili or Hausa, where they're very communal languages. So we worked really hard with translators to try to define these terms better. We did some social media monitoring early on in the crisis in different languages. We did quite a bit of mapping to help us help responders understand what languages are spoken in different areas that maybe hadn't had a recent crisis or weren't on the highest attention of a lot of responders previously, so they hadn't worked in these locations before. We've done quite a bit of training during this response, mostly having to adapt to remote ways of working and training over Zoom and webinars and different digital means, which is a challenge for connectivity reasons. And then we've done quite a bit recently work into natural language processing and chatbots, which I think I'll talk about in a little bit later as well. I think the questions about some of our challenges, one of the big challenges I think that we faced in this crisis is the scale of this, of the language demand. Just to put it into context a little bit, when we started doing work in Northeast Nigeria in the tail end of 2017, if we look at probably the next 9 months after we started there, which is relatively about what we've been doing COVID response for now, we had translated close to 100,000 words in 9 different languages. If we look at the Rohingya response in Bangladesh, we had translated quite a bit more, probably 300,000 words in about 5 different languages. And in that same time scale, during the COVID response, we've translated 5.4 million words in 105 different languages. So it's just blown every other crisis out of the water as far as the breadth and depth of language needs. We've never seen a demand like this. We've never needed to mobilize community members across 100 different languages all at the same time. So it's really stretched all of our resources, all the linguistic resources, and then obviously everybody who's trying to provide support in these languages. It really makes it a real challenge. Even within that though, we still do see a huge focus on European languages. Our largest languages that we translate still under COVID are French and Spanish and Portuguese. And so there is still a dominance of large European and international languages, but it's getting a lot better. And as the response moves on, and we're starting to see languages like Kanuri and Swahili starting to grow in the scale of what people are translating. So I think that's the biggest one that comes to my mind right away.
Thank you very much. And I'll pass to Christina. Please, Christina, over to you.
Hi. Christina here. Hi, I'm speaking to you from Insecurity Insight from near Geneva. Insecurity Insight monitors violence and threats of violence that affect aid operations. And as the COVID-19 pandemic was declared, we collaborated closely with aid agency security focal points via the Global Interagency Security Forum. And the objective was to share information from the monitoring we were doing to help aid agencies to adjust and to adapt to the new situation. But it also meant that we had to adapt quite a bit, because as many aid agencies decided to repatriate significant numbers of their staff, and lockdowns were introduced in one country after the next, and everyone started to work from home, we actually saw that the aid security incidents that directly affected aid operations dropped. But at the same time, threats and violence against health workers grow tremendously, enormously. It was really quite shocking. Every day there were sort of more and more events coming in. And these violence and threats against health workers in the pandemic affected mainly local health workers, but to some extent also international aid agencies active in the response. And in this context, also social media stories that sometimes really intended to incite violence against health providers in the pandemic were very important. So that was the sort of the key work we were doing. And Insecurity Insight monitors events that have happened. So that in that sense is very different from what Candice, for example, talked about, or I think what Meg will be talking about, which is looking at perceptions. So we look at events that have happened and we try to document them and make sense of them and help aid agencies to work with that information in terms of their planning. So for us, the challenge wasn't so much to adapt to new working, because we've always worked remotely. But for us, the challenge was a little bit similar to Eric's. It was just the amount of information that was there, and trying to find the information that's relevant, to find it effectively, to process it quickly, systematically, and to share it. And other sort of challenges we always face is that the data we get from our monitoring is never representative. There's always some events that are more covered because they're bigger, because they affect particular populations. And there are always events that are rarely covered because they occur in certain contexts where it's difficult to talk about. They affect people who are just not really in the news all that much. And increasingly, we also face the fact that there may be deliberate fake stories out there, people telling invented stories in order to influence opinions. And then there's social media with even more information out there. So in a nutshell, the big challenge we are facing is the quantity of information and how to make sense of it and how to get from it that really matters, and not being led by misinformation. So with that, I'd stop and pass on to the next one.
Thank you very much, Christina. And I'll now ask Meg. Meg, if you can hear us.
Yes, thank you.
I will pass it on to you.
Great, thank you so much. So we've been tracking the perceptions of people living with the impacts of ongoing crises, as you would expect from ground truth, most of whom have been recipients of humanitarian aid for a while, to see how they feel about the ongoing response to COVID-19, how it's impacted their lives and their ongoing access to aid and services. And also what this means for their economic situation and how much they trust the efforts that are ongoing to contain the risk of COVID in certain locations. And we're doing this work to help inform response decisions. So to try to make sure that people who are managing the response to COVID-19 have the views of those who are supposed to benefit from those interventions front and centre. I think one of our key challenges has been on adequately conducting this perception work such that it's still worthwhile for those that we are interviewing or surveying. And by that I mean on the ability to close the loop properly, both with affected people and also with the responders. Given all of the new restraints on data collection and also on community engagement, we found that it's not actually a challenge to just do our work. I think when COVID happened, we really thought that it was going to be, because most of our work was face-to-face. We weren't really sure what our year was going to look like, whether we'd be able to do anything at all. It's become very clear that it's still easy enough to do a data collection exercise anywhere, but it's a challenge to be really ethical about it and to make sure that the process is rigorous enough that both the affected people and the responders have a level of trust in the process. Because if that's not there, then there's kind of no point doing it. We've seen that COVID has really risked becoming an excuse for a lot of people to stop engaging with communities, which seems counterintuitive, but particularly at the response-wide level. We've seen humanitarian country teams and response leadership to some degree kind of say, you know, well, this was a priority last year, but now there's all these unprecedented events and we just have to focus on those. So this kind of systematic approach to accountability and community engagement kind of slips. So we're trying to make sure that we're not contributing to that mindset by trying probably much harder to make sure that we can stand behind the data that we collect. And those challenges are things like, how do you make sure that you're reaching a representative sample when suddenly you've shifted to a methodology that sort of instantly makes that harder? How do you make sure people aren't being over-surveyed now that surveys really are flavour of the month, particularly over the phone from people, even if they've never been doing surveys before, because that's the one way that they can engage with communities. And how do you get back to communities to tell them, you know, what we found, workshop the data with them so it's not just an extractive process? And then probably most importantly for us, how do you make sure that those humanitarian and health workers who are suddenly working under all this extra strain, with their attention elsewhere, probably less time, potentially less resources, that they're still ready to listen to what you're saying that you've gathered from community members? So we find the challenge of closing the loop probably the most challenging, more so than the process of just collecting and analysing the data.
And apparently the poll confirms what you were saying, that this is one of the biggest challenge. The idea, there's 73% of people that were saying that closing the loop is a key issue. And I really like your point on, you know, COVID being an excuse for so many things. And I think this is something that we can also build upon further in the Q&A if it interests participants. I think there'll be a new poll on if you have other challenges among the participants to share that will soon pop up. But while we're going, we can continue on the next round of questions, which will be asking our participants to figure out, you know, some of the methods and solutions that they found to all of these challenges that they've identified. And what we're looking for is like very concrete solutions, because obviously we hear of so many sort of higher end points, and the idea really here is to ensure that participants leave with ideas of where they could go forward also. And it can be either new or old solutions, because everything isn't about it being an innovation, either technological or more human oriented. And in particular to replace the very frequent in-person quantitative data collection and field exchanges with the community that used to occur in the traditional way. So if I can ask each of the speakers to suggest a solution and also look at the pros and cons of the solution, try and be as objective as possible in presenting those, in particular in terms of data quality, and also in terms of connectedness with the populations worked with, as this also relates back to closing the loop, as we were saying just before. So maybe I'll ask Eric to go first this time.
Sure. So one of the things we noticed really early in this response was that there was a huge influx of chatbots. And this is something not new to the humanitarian space, but definitely the quantity and scale that they were coming out for this content. I think this type of, you know, a health pandemic content is really tailored for that type of automated messaging. And for those who don't know, chatbots often get presented as sort of, you call in or you text in or WhatsApp into a line, and you can sort of get a menu of options that you can choose from if I want to learn about symptoms to COVID. And this is how they are getting presented. And we noticed a real problem right away. One of them was they're only available in major languages. So in, you know, DRC, you might have a chatbot available in French only. And what that does is it reinforces existing language biases. It makes sure that people, you know, the only people who can access your communication mechanism are people who speak that major language, who are often educated, they're often men, they often live in urban areas. And what that does is excludes often women, elderly, children, and people in rural areas. So one of the things that we looked at is said, okay, we're not going to completely get away from, you know, digital support in this response. Like, there is going to be a digital focus, and that's you know, to talk to one of your drawbacks, that's one of the drawbacks of any digital solution, is it's going to rely on people being able to connect to it. But we actually started a pretty large initiative in DRC with UNICEF and under the Paul Allen Foundation and some other partners that looked at switching the script on it. So instead of a menu-based chatbot, actually it would take in natural language. You could ask it a question in sort of your own words, and it would understand it. This chatbot's now available in French, Lingala, and Congolese Swahili, so making it available in more localized and regional languages there. And what it really allows us to do is not just find out what we thought we wanted to know. And that's really important, I think. And it's a broader lesson, not just for those who work on chatbots, but who are doing any data collection. Is like, we shouldn't be always finding out stuff that we wanted to know. And if we pre-script answers, for example, in a survey, and we give A, B, C, and D as the options, what if they had something else that wasn't one of those four, right? We need to be receptive to the fact that they might want to tell us something totally different than what we want to hear. And I think that's really where we shift the script from talking to people to actually listening. And so in our experience, what this allowed us to do is, you know, we'll find out that we had a whole bunch of content that wasn't even part of our menu originally. We had a whole stream of content that we weren't anticipating people wanted to know about. And all that shows up in the sense that it doesn't match our intent classification models that we develop. And so then we can develop new ones on the fly and adjust the bot so it can improve as we go. But if you're doing this in a traditional data collection effort, I think the lesson for me is we need to be open to listening to people in language and in open-ended questions, even as simply as that. We need to hear what they're saying in their own words and then do the hard work, which it is really hard work to understand what that means. Sometimes it involves transcribing open-ended answers or interviews. Sometimes it involves you know, doing a whole series of translation work. Sometimes it involves keyword detection and some quick analysis tools that you can use. But in all these cases, you're actually allowing the person to say what they want to say and open listening. I think that's really key. For us, we don't think it's scalable. I mean, we're a specialized translation network, right? And we have, you know, 30 to 80,000 linguists, depending on what metric we use, that are available to us to help support in hundreds of languages. And we still struggle with the scale that this demands, open and listening demands. So what I would say is we can't do this without technology. We can't do this without things like Google Translate. We can't do this without things like natural language processing. And those are going to be really key, and making those available in less high resource languages is going to be really key to the next stage of these types of responses.
So in a way, listening is the key, but at the same time, very tricky to implement and very time consuming. Thanks, Eric. Christina, would you like to share an Insecurity insight experience?
Hello, thanks. Yes, I think I just concentrate on one example, that sort of response to the big challenge I mentioned, that there was, or there still is, far too much information out there to make sense of it. So the solution we applied to that is that we developed algorithms that help us identify relevant information. So the way that works is, I think pretty much, as you know, when you buy things, let's say on Amazon, when you buy something and then you get the list of things at the bottom that suggest you may also be interested in this and this and this, because someone else who bought what you've just ordered liked also, or also bought these things. So that's sort of the same kind of principle we apply to information. So we looked at the events that we thought were relevant for the aid sector. And we look at events that affect aid operations, but also healthcare, education, and violence in IDP settings. So we looked at these very specific events and then trained an algorithm to recognize these events, to then suggest to us when there is another story out there in this huge, massive pool of online stories, to suggest, hey, we think this is also what you're interested in. And we think it's about healthcare, we think it's about education, we think it's about COVID. And this is really quite exciting work. And we trained it on OSAC information first, because that was a lot of relevant information. And it worked really very well. And then we thought we'd take the plunge and we go bigger, and we link it to all sorts of really big online information sources. And then we really started to hit the challenges. And I'm sorry to say we haven't sort of solved all of them, because what we discovered were that there are many underlying algorithms in these big information sources that are out there that seem to filter the information in some ways that you don't actually realize when you just Google through it, and that it's extremely difficult to understand what's behind it. And we've written to them and asked questions and never got any questions. But there must also be some sort of geographic linkages around it, because suddenly we got a lot of US school shootings, but we never got the school shooting or the killing in the schools in Cameroon, for example, through that particular system. So we need to make sure with our algorithm that we link to the relevant sources that really cover what we are interested in, and don't get misled by what, and I'm not totally sure who or what is determining what is sort of feeding into the big news providers. But that for us was a very, very interesting journey to just see how many people obviously are already using algorithms, and we, with our very specific aid-focused ones, can't necessarily just jump on top of it. But yeah, so that's one of the sort of solutions we're finding to the amount of information that's out there. And then one little other aspect linked to it is, because once you have all of this information, how do you make it sort of systematic? And for that, we've also developed some natural language processing systems that automatically discovers the location, the date, and who did what to whom, and that helps us to sort of structure the data. So I think there is a lot of potential out there for H2H members who support the aid sector to find, to use technology and these sort of algorithms and natural language processing to provide the right information. But I think there's also many other challenges still out there, because so much is geared towards the commercial sector, and that might not make it all that easy for people concerned with aid concerns to really identify the right information, even if we're getting this smart technology. So with that, I'll pass on to the next panelist.
Thanks, Christina. Well, without further ado, Candice, do you want to share an ACAPS solution?
Sure. So I think the solution here in Cox's Bazar lies less with technology and more with understanding of the different data collection methods and increasing the use of qualitative data. So the reduced capacity of responders here to conduct large-scale representative data collection methods, specifically under quantitative data, and the increased need for quality data that reflects the situation on the ground, helped reveal a combination of smaller primary data collection exercises, both qualitative and quantitative, combined with secondary data, is what's needed to provide that overall picture of a complex reality. So during the response, ACAPS was fortunate enough to partner with IOM's Communicating with Communities unit and their team of trained Rohingya researchers, looking at perceptions and experience of Rohingya refugees throughout the COVID-19 response. The topics that were investigated were often a combination of what the Rohingya refugees wanted to communicate back to the response, and also the topics that responders needed at that time to feed into their programming decisions and planning. And sort of the aim was to elevate Rohingya voices and connect it to that specific decision-making aspect at the time. And this method was able to be employed during the pandemic because IOM's Rohingya field researchers had been trained prior to COVID-19 response for a full 6 months in qualitative data collection methods, participatory methods, participant observations, thick descriptions, and open-ended semi-structured interviews. They're also trained in using audio recording of the interviews and transcription, as they were originally set up for research into Rohingya culture. And so this team was able to be repurposed and conduct community perception interviews and things in COVID. And this team was able to unpack more sensitive topics and work past some of the trust issues that were commonly faced by external data collection teams. And the example I gave before of health clinics where quantitative data was unable to explain what was contributing to the drop in consultations and what was driving the negative rumors around health clinics and the difficulty in consent and testing, this unit was able to sort of add explanations to that and add information that would help responders develop a strategy to build trust and adapt approaches according to people's preferences. And I feel the need for qualitative data had been a topic of discussion in the past and pre-COVID, However, because it's a really data-rich environment here in Cox's Bazar, everyone is collecting data all the time because the affected population is normally so accessible that it was really hard to see which data collection methods were adding value for what information gaps. So the sudden inability to be able to collect that information and access the camps sort of catapulted really good examples, and we're able to fill different information gaps and help responders identify what information they need for what decisions. And the cons of this approach, though, it's very resource intensive in terms of data analysis and translation and data management. So for example, we do the data analysis support in this process, and we're currently undergoing a really large qualitative assessment with the team, with IOM's CWC team, using, so we're conducting the data analysis and we're expecting almost 200 transcripts of around 5 pages per transcript, and we're going to manually code that into NVivo. So I mean, it is a really resource intensive process, and if you don't have the team there that is able to manage that amount of data, and you don't have the translators and the team that is able to collect the audios, it is a very difficult measure to implement. I'm going to leave it there.
So both very resource intensive again, and also requiring having proper processes in place prior to a pandemic of this sort. Meg, what would you like to share as a solution?
Yeah, thank you. I think like Candice, mine is a bit more low tech than some of the others. I think that we found that when COVID took hold, we were sort of getting a lot of questions from donors and partners saying, oh, is this where, you know, Ground Truth is going to try IVR or scanning social media, or just sort of things that we had never done before. But we actually found that relying on relationships with community members that we had forged well before the coronavirus actually worked really well, both at the community and the response level. So one example of that would be in Uganda, where because we had been doing perception surveys for many years, and in the areas where we'd been doing such surveys, we always ask questions about people's most trusted methods of providing feedback, or, you know, who they sort of trust as proxies in communities. And because of that, we had this whole network of community leaders in Uganda who we were already in touch with, that we were then able to kind of contact them and say, you know, we can't come and do a face-to-face data collection exercise that's representative, but given that we already had this trusted source and this amazing network of people who we could call upon, we started doing key informant interviews with them. And we just found that that led to a process that became more and more, I guess, trustworthy as time went on. So they were able to put us in touch with more people through a sort of snowballing effect. We were also able to stay in constant communication with them throughout the process. So we would collect the data, go back to them, ask them what they thought about the analysis of the data, given that it wasn't a representative exercise, to see whether those findings still seemed right, if they needed further tweaking, etc. And also if it was something actionable for them that they could use. So we found that to be quite useful. Similarly on the responders side, so in Iraq, we've been tracking perceptions response-wide for many years there, which had enabled us to build really strong relationships with the humanitarian country team. So we had this wide open door on the decision makers side. But we had also recently established a really close working relationship with the humanitarian call centre there, because in our previous work, we had asked some questions that specifically pertained to their work. So that meant that when COVID happened, we were able to really quickly work with them to devise a methodology where we repurposed that hotline for the first time to become a proactive representative feedback collection system, rather than a sort of voluntary one, and then adjust the process as we went along. So as we found, for example, that, you know, that meant we weren't talking to as many women, we were inherently talking to people who were already in contact with aid providers, so therefore there was some bias there. We were able to build on some existing relationships also with, for example, the CASH consortium of Iraq, to bolster some of those quant findings with qualitative ones. And so while it has been sort of a complicated process, it has led us to an ability to collect data remotely in a way that we can inherently trust, I think, more than we were expecting. So I think we did just realise that in our experience, the countries where we were trying to do data collection for the first time were obviously much harder, but also just in ways that you wouldn't know necessarily. So we sort of don't recommend that now would be the time to try and forge relationships either at the community level or the response level. So
it goes back to the question of a long-term approach in terms of data collection and trust with communities. Let me just share two of the challenges that the audience added before handing back over to Claire for the next round of questions. So there's the question of correlating connectivity to healthcare and education intervention areas, and also the aspect on the challenges of finding local disaggregated data about COVID-19, especially for some countries which don't have a solid statistics structure that follow the spread and impact of COVID at different scales. So it's a little bit the opposite. We were talking about the infobesity and quantity of data, but also there's a lack of data sometimes on the key topics that you need. Claire.
Yes, thank you, Maeve, and hopefully you can still hear me. So, I mean, we've reached the final round of this insightful conversation. Before we open to questions from the audience for Q&A, and obviously I'm not well placed to say that events we're facing in 2020 are disrupting aid efforts across the globe, that change is not anymore an option, but an imperative, because we know it all too well. But what I can say and want to say to conclude is that it's not anymore a far stretch to foresee an immense need, for example, around expert information management or data visualization to support, and that we'll need to face that and to address that in the near future when a vaccine or treatment become available and human rights are at risk. And parallel to that, I also see that networked responses, and H2H is part of this, are increasingly being recognized as important components of the humanitarian value chain. And I can see that H2H organizations are agile, nimble, they bring expertise to support a more efficient and accountable response. So that makes them, and that makes us well positioned to accompany, to enhance the change that is needed. So to conclude, there is an imperative a responsibility for us to learn and to adapt better and quicker than ever in this unprecedented crisis. We've touched upon a lot of weaknesses in this conversation. Now, how can humanitarian data practices come out stronger of this pandemic? That's the question I'd like to ask our four speakers in the form of one recommendation or one final thought that you want to share with our audience today and with the wider sector. So I'd like to pass to Candice first, and we'll go with the other speakers then. Candice, over to you with your final recommendation for this first round.
Sure. So I think for humanitarian data practices to come out stronger, we really must be prepared, because agencies here had to learn on the run. And I think there is a lot of good lessons learned here that would prepare us. I think the major one is, where possible and appropriate, localized research and data collection. Response actors should invest in and recognize the capacity of the affected population to work as researchers and enumerators. The ongoing investment in training and skills of the affected population will guarantee access when entry is restricted. And this should also result in the affected population taking the lead in research design. And using the affected population as researchers also helps overcome trust issues, especially for the population here and the Rohingya refugees, and also to support the development of a deeper socio-cultural understanding that we learned during COVID-19 was essential to be able to adapt programming and make the programming appropriate for the response, being able to tailor the programs to the affected population. Secondly, the increase in understanding which data collection methods are appropriate for different information gaps, and for the specific affected population that you have. And as I mentioned in the challenges before, remote mobile data collection is really important, especially when you're trying to collect representative data and trying to get a scale of needs. But here especially, it needs to be prepared. You need to have a representative phone database. Data collection teams need training. The affected population also needs to be sensitized to the approach and used to that sort of data collection method, and have access to the technology needed to actually participate in that. Another thing that we learned was, of course, the importance of coordination between data collection actors and the need for data sharing practices to reduce duplications, ensure data is used to its fullest, and inform overall data collection quality and standards. I think the major thing is it's less about having a lot of data exercises and more about sharing data and knowing which information and which assessments can fill which gaps. And I think in doing this, your secondary data will be a lot more easy to use and better when you do use it. I think I'm going to leave it there, and unless I'm well under time.
Thank you. I mean, you've shared already more than one recommendation, so that's amazing. Thank you. And can I ask Meg, do you have any recommendation, singular or plural?
Yeah, I think mine would just be that it would be good if we were all a bit more honest about our limitations during this period. I think that we've been trying really hard to be honest about the limitations of our work and to address them where possible. And I think that has made us as an organisation probably a bit stronger this year, just in the sense of our sort of striving for more statistical rigour, more assessment of power structures, and more, I guess, practical data sharing between agencies, as Candice was touching upon, but also just a better understanding of what works and what doesn't, sometimes by trial and error, when we're looking at remote methodologies. We found that, as I said before, we've been able to do phone surveys, but it's really interesting to really sit down with a data collection exercise and say, whose voice is missing from this? Is a phone survey really the right way? How do we know that we have the right phone numbers? How many people do we need to call to get the right number of people? How do we make sure that there's enough women in there? Do we know if we're talking to anyone with a disability? How do we increase those numbers? How do we explain and weight the data for possible biases, which has been another whole can of worms? And I think, I'm not pretending that we're getting that right everywhere, but it's so important, I think, to try to get that right and not take any of this data at face value. We've seen a few survey processes this year that we found pretty alarming, not just because of the lack of rigour, but because of this mass broadcasting of findings where maybe the methodology wasn't really such that it would be responsible to do that. So I think we're really trying to focus on documenting what we're learning through this process and sharing those lessons widely, and also trying to learn from others. But I think if we as a sector just kind of admit that this year's been very difficult and talk openly about where we've maybe failed or could do better, I think we could all come out much stronger.
Thank you for sharing those honest, very honest recommendations. Eric, can I pass to you? Would you like to share recommendations?
Sure. One of the things I was going to talk about, I'm really glad Meg talked about this and Candice did, is just being explicit about our bias. So I'll just reiterate how important that is. Like when if we start adapting qualitative data collection at scale, like a lot of us are recommending, and like a lot of us have been forced to do during this crisis, we will have bias. I think I saw a question in the chat, something about what happens if technology fails. The question is actually what happens when technology fails, because it will, and it will expose us to bias. And if you're not planning for that, and if you're not being explicit about how it's failing or who it's failing, then I think we're not doing our part. So I would just reiterate, I love that point. Be explicit about it, be honest if it's not, if you weren't able to talk to enough women, be honest about that. If all of your enumerators speak French and that's all that you could find at the time, just state it in your analysis and say one of the possible limitations here is we only spoke French to people in our survey, and that probably only reached people who have a certain level of education. It's just really important if we're trying to collectively better utilize other people's data and secondary data that we have an understanding of what that bias was going into it. I think the second piece, and Candice talked a little bit about this too, is preparedness. It really, I mean, we talk about this all the time. Every crisis we get back to the point, like we should have been better prepared, and then we run out of time the next crisis. I think for us, one of the easy things, and this is maybe a low-hanging fruit, is like in data collection, there's a lot that we could do ahead of time. From a translation standpoint, I can't tell you how many questions that we, and like surveys that we've translated after this crisis that were just, you know, what is your gender? What is your age? What country do you live in? Trying to translate that during a crisis when your teams are really strapped for time and resources doesn't make any sense. Like we should have all that ready to go. So there's a lot of things from a language standpoint that we can prepare for, pre-translating things, understanding what languages the communities are trying to speak, that we're trying to communicate with speak in the first place, so we don't have to guess, and that gets into just having a good understanding of the population you're working with and doing some mapping of the area, that so you're not sort of surprised when something comes up and you need to support it in a language that you weren't prepared for. So those are my points.
Thank you very much, Eric. And Christina, it's landing on you to conclude with your final recommendations.
Well, I think if I would be asked what has been some sort of opportunity or some positive that has come out of all of these new approaches that people were forced to take, I would say it has actually opened up a lot of opportunities to work remotely. And I think I'll just give you 3 reasons why I think this is a good thing. First, the caveat, it obviously has to be right for the right context, and it doesn't work in all circumstances. But I think there are many more areas in which the humanitarian sector can work remotely. And here now my 3 reasons why I think this is a really good thing. Firstly, it forces you to rely on the local voices. And specifically in what we are doing, when we are monitoring what people are saying, what events they're reporting, we have to go to the local papers, the local news outlets that are now these days all online. And this allows us to actually tell quite a different story from how it was traditionally done, which, to put it crudely, was someone from a northern hemisphere flying in and then talking to various people, and sometimes with a beer in a bar, and reporting what they thought was the reality on the ground. So by not being able to fly in, the only thing we can do is collate and put together the local voices and amplify them. And that, I think, is a real opportunity that comes from being forced remotely. And the other 2 reasons I would throw in there is that it actually saves a lot of time of money. And perhaps some of that money can actually be spent more at the front line where it's really needed, rather than on us flying around the world and staying in hotels. And the final point is that we all talk about climate change. And I think if we can reduce our travel, also as a humanitarian aid sector, I think we're also living as an example. So with these 3 points, I think it's not all gloom and doom. I think actually the way we were forced to change may actually open up some opportunities. And I would really hope that we may actually learn to take forward some of the positive ideas that we were forced to come up with during this rather challenging time.
Thanks, Christina.
Thank you very much, Christina. And just to add, perhaps that learning piece will be developed at the back of these conversations, because it's so insightful, the different components to the conversation. We're going to capture that and develop lessons learned. Yes, just to add to that, Maeve.
And lessons learned in particular about failures and about the good side of being honest. I mean, a lot of these topics could also have been food for thought for the Failed Fest of tomorrow evening, actually. So it all relates back in a way to the theme also of the event, being inclusive and responsible in our practices. And I really liked some of those findings you made. Maybe just to ask a first question before we hand over to the audience, because I really wanted to build on what was just said. So we're all aware that it really helps in terms of localizing aid. The fact that we're all forced to, well, not all, but that a lot of the work being done is being done remotely. But how would you say we can keep this up as a good practice after this crisis? Because it's so easy to fall back into our old ways of doing things. So are there any thoughts from any of you as to how we can just ensure that we make this a common practice, as when it's relevant? Of course, it's also sometimes necessary to fly in, but what are the ways that we can ensure it can be as sustainable as possible? So anybody want to take this one up?
I can jump in. I mean, one thing that we've found in concrete terms is we're being asked more and more to support local and national NGOs to kind of do what we do. And that's been really interesting because I think we see that as being a really positive thing. But what we have realised is that we will often get asked, you know, sometimes from donors, to sort of impart what we've learnt from tracking perceptions directly to national NGOs. But I think what's missing there is the fact that we, you know, this work it doesn't cost a lot of money, but it costs money and it costs budgets that we have. And so you can't just sort of expect a national NGO to then be able to do exactly the same thing just by telling them how to do that, without actually supporting them with some additional resources to be able to do that work. And so I think there is a really big opportunity at the moment for not only kind of data collection specialist agencies, but the donor community potentially to work together on this, and thinking about how some of this work can be a bit more localized so that we're not all here sort of scrambling for how to do everything remotely always.
But in a way, this like the cutting budgets that that a lot of donors will think is now feasible because so much could be done remotely. Is that not another challenge that we're going to have to tackle to show that it's not cutting budgets, it's really transferring budgets to the right approach? Eric, you want to?
I'd actually just following on what Meg was talking about and your point about budget. That was going to be my point. Is like we need to budget for. From a language standpoint, we need to budget for translation and for language support and data collection. I think what COVID has showed me a lot of times is we internalize a lot of language support in our processes. So I'll talk to partners who say, oh, you know, maybe we tried to budget a little bit for it. It was the first thing that got cut because it seemed like a, you know, an extra expense, but we did it anyways. And that statement I think is really eye-opening because the fact that you're doing it anyways shows that like you're internalizing all those costs. So it might be your M&E team that's being asked to translate or transcribe stuff. You might be putting that burden on the community or the enumerator themselves. You're asking the enumerator to not only translate and have a really difficult conversation with somebody, but then to sight translate that and to transcribe it back in a language they're not that comfortable with when they're documenting. This is a real big challenge sometimes. And if we're talking about how resource intensive it is, I think it's an important thing to keep in mind that yes, you do actually have to plan for it explicitly and put it in, but as a budget item, and make sure that you're accepting that it will take time too. I think Candice brought that up when she was saying how many transcripts they had to go through. Like, it really does take time. You know, the amount of times we'll get a request to translate an entire survey tool that's going into Kobo in 8 languages and it needs to be turned around in 3 days. Like, it's not feasible. Like, no one can do that well, and you can't do that and still verify good quality. So we need to make sure that we're budgeting the resources, budgeting the time for to take care in what we're doing.
Thanks, Eric. Okay, let's go maybe to the first question from the audience. from Fred Gibaudon. Algorithms are usually designed to outline trends or identify patterns. They were developed to be statistically helpful. On the other hand, humanitarian action is seeking not to leave anyone behind, to be more inclusive. Have you had to add specific measures to fill that gap between the two purposes and possibly take advantage of both approaches? So I don't know if maybe Christina, you want to respond to that one?
Thank you for this question, but it's such a difficult one. So I try to be really kind of short and precise, but anyone who'd love to have a more detailed discussion on this, please get in touch afterwards. So I think many of the algorithms are set up to nudge us in certain directions and make us look at the same things that we've already looked at. And that I think really has a huge risk in the way, as you point out, because if the people who are left behind are not part of that initial story, then they're left out even more. And in terms of the way, what can you do about this? So if you depend on other people's algorithms, I'm actually personally incredibly skeptical about what this is doing, because there seem to be so many biases in it that seem to take out certain countries even from it. So what can you do about it? You can train your own algorithms. You can put in there and retrain them regularly, as regularly as you want with the information you have. What you don't get around the fact is that you're training them according to your own biases, because everything you select, that's what you're training it with. So I think the really big challenges we are facing here is how can we get a more representative group of people that can help us to train the right algorithms that we need for the aid sector. And I think this is a huge, huge challenge. And it is such a huge challenge because you very often don't even understand the underlying biases that are in the information you're working with. So yeah, I don't know whether that's a helpful answer, but I think it's an incredibly important topic we all need to think about more, because it influences very much what we see and think, and what we see and think is what we react to. And so it is extremely important.
I have a kind of answer to this. It's not really related to algorithms, but it is related to technology, I guess, and reinforcing biases in that. One of the things we deal with a lot is language technology. And so if you think of an example like Google Translate or Microsoft Translate or Amazon Translate, they all rely on data to form the foundation of how well they can translate your information. And that data is really well available in commercially viable languages we talk about a lot. So it's languages that have a commercial sector and an interest for these companies to invest a lot of resources and time in it. And also just languages that there's a significant amount of, for example, books that have been translated or websites that have been translated that they can use to train their data and train their models. When that data doesn't exist for languages like Swahili even, or Hausa or Amharic, these are languages now where our sort of, we might put it into a translate tool and say, oh, we got a result, but it's actually not very reliable. And so we're reinforcing the fact that we're training on a low amount of data and working with a tool that we don't know how reliable it is. And I think the first thing that I would say is, technologists are part of this solution. Like, we've been working very closely during this crisis with Google and with Amazon and with Facebook and with Microsoft that have been trying to build data sets for low resource languages under a project we call TICO-19. And this project in particular, they pooled all their resources to try to build larger data sets for this because they saw the humanitarian imperative in this. So I would say we shouldn't be too skeptical. We should be willing to admit where there is bias and where our sort of models might be falling short. We should quantify that once again, and then we should work to fix it. And part of that's filling the data gap. And I think that's a really important thing that we've noticed is part of the problem. So.
But when you start like playing the game by the rules of the GAFAM, etc., how do you make sure that they're not building these models for something that you haven't intended today? And how do you sort of protect also populations of concern from new technologies that are being tested out on them when perhaps it's not something that should be the case, or else would be reused in another context in a way that is not ethical in terms of humanitarian principles. And it's just throwing it out there.
Yeah, thanks for the easy question, Maeve. No, it's a real good question. I think the key is being very careful in how you're in sort of the ethical framework that you put together for any data collection exercise. And this gets down to how do we control for and show caution towards personally identifiable information? Are we exposing that in our analysis or in our sharing of data? This gets down to what type of data and what level of data is being made available. I think the open source and Creative Commons solutions are amazing, and I think we all should be striving as much as we can carefully to go towards that route. But then we need to be careful and make sure that what we're doing is done with the utmost care. I think part of it too is just informed consent. Like, people should always know what their data is being used for and agree to being used for that data, for that purpose. And that gets into making sure that they actually understand and they fully comprehend why what we're asking them to do and whether it will be used for other purposes or
not. We have a question in the Q&A. Why are organizations so afraid to share their bias? What could be the practical solutions to promote more honesty, as mentioned? So who wants to take that one up?
I can have a go at that one. I think one of the things that could be done is really trying to foster that type of environment. So if no organization is sharing their limitations properly, and everyone is holding their data really close to their chest, no one's going to make that first move. And I think that could be done, for example, here in Cox's Bazar at the sector level or at the coordination level. There are information management and assessment working groups, and there are coordination mechanisms that we could possibly sort of push to start that standard. And I think once agencies do start to share their limitations and really talk honestly and openly about their limitations, and then maybe hopefully that would mean that other agencies are going to be willing to do that. Because I think at the moment, if no one's doing it, no one really wants to take that first step.
So in a way, it's learning how to turn a weakness into an asset.
Yeah.
And in a way, the first one who actually does it can be setting a trend. Does anybody else? Yeah,
I would add to that I mean, whenever we've done it, it's been really well received. And I think it is because people just aren't used to hearing organizations say, we did this and it could have been better, or, and so I think I agree with Candice that I think if more of us just did that, it would become a culture, and then it would be less odd for an agency to have to be the only one who's sort of standing out on the ledge saying, oh, we've stuffed something up. But also I think it could be incentivized a bit more within the sector. I feel like also maybe donor reporting to some extent might encourage this in certain ways. I think people sort of have their log frame and they want to be able to say that they've achieved everything that they put in the log frame. And I know that a lot of these panel type discussions always come back to a conclusion that donors could be more flexible. And I'm not just saying it's that simplistic, but I think that there could be sort of more of an encouragement for, no project is ever perfect. So more sort of sharing that in a way that would make the next project better, and being able to say that is inherently a very positive thing, I think is not somewhere where we've got to yet as a sector, because we are so paranoid about where the next funding's coming from and how well we achieved what we said we would achieve for our grant. So I think there's probably a role for donors there as well.
I'd add one quick thing is that we should just think of it differently. Like being explicit about our bias is not identification that we did something wrong. It's really like an appreciation that we are doing something right. It's, you have a better analysis as a result of having explicit bias in your analysis. So if we know that we're, you know, weighted towards a certain gender, like, why aren't we telling you that? Like, that's a, you know, you will have a better time interpreting our data and our findings if you do that. And so we shouldn't think of it as a weakness. We shouldn't think of it as a vulnerability, or the donor is going to think we screwed up or that we weren't using the resources. Like, it should be seen as just something we all do because it's better analysis, it's better data practice, and it just makes more explicit what we might know, but that we're not sharing to you. So.
If I could perhaps just add 2 quick thoughts. I think there's also a role for an organization like H2H in promoting this in a way. And the other point I would make is that there's also possibilities for learning from other sectors, because within the actual research sector, every project has to have huge policies on ethics and methods and reporting and making the data available for anyone else to reproduce the same results. And I think there is a lot of room for applying some of these really very useful research principles also to all research that's done within the humanitarian sector. And I think if an organization like H2H would sort of promote that across the board, then it would really help that more organizations do it, because as everyone said here, you know, it's difficult to be the first to do it. But if it becomes the standard, then I think everyone benefits.
So both the role of support organization, the role of donors, the role of the NGOs themselves intervening, and all the coordination entities. Another question from the Q&A. So what would be your advice for an organization who wasn't prepared to change their data collection methodologies? So how could you help them shift, especially remotely, from quantitative to qualitative participatory approaches?
I can take this one and start the discussion. I think the best thing to do is to connect with other actors on the ground and really see who you can partner with, really see what other information and what other data collection is happening, and whether your information gaps can be filled with that firstly, and then having a look at secondary data and things like that, and not going straight from, okay, we can't collect our data this way, we have to collect it somewhere else. Sort of trying to figure out what other information sources are out there and what other actors there are collecting information would probably be the first step. And then I think there would, hopefully after COVID especially, there'll be lots of documentation on lessons learned on how to do, how to adapt your data collection methods, especially trying to learn a new method remotely and during an emergency. So hopefully there are guidelines and methodologies out there, or there are H2H actors that can support that process.
Okay,
I think there's also something to be said for just sort of proving the benefit of that. Like, I think that there's a lot of guidance for a lot of things in the sector, but it's only when people can really see why something has worked somewhere else that maybe they'll then be more interested in taking it up themselves. So I think the more lessons, like I think the work that ACAPS has done with IOM in Cox's Bazar is really interesting. And I think things like that can be shared more widely, where then people could say, you know, by adding these other layers of analysis, they were able to find out this and they used it for this reason. I think is often, at least in our experience, much more effective than sort of trying to produce guidance for everything, because I think people just sort of need a precedent and then they trust a process enough to be able to take that leap.
One thing I'd suggest is, I think sometimes we get bogged down in the idea that, like, to do this well or to adapt in this way, you have to have a really like well-developed network of data collection team, really hyper localized, hyper grounded in the situation, who have been doing this for 2 years. That's not always going to be feasible. And especially if you're just adapting to this at the last minute or weren't prepared for that, you're not going to have that. One easy recommendation I would give is try to record your conversations. Use audio recorders more than we do. They're a great tool with consent, obviously, as long as people know how they're being used and you have a good data protection practice in place. Record interviews, record surveys, use audio recorders as a valuable tool, because it allows you to go back and take your time. It allows you to verify something if your enumerator didn't document it in the exact right way. It allows you to troubleshoot if you're noticing bad trends that are showing up that you weren't prepared for. You can go back and listen to the files and figure out, oh wow, they weren't even asking people for their consent. We need to rethink this. So there's a lot of things that you can do if you have that data available to you, and it's just a valuable tool. Technology is there, it allows you to do it. I think that's one of the nice things that we've all had to adapt to, is a lot of people are recording things now because they're happening over the phone. Like, we should keep doing that after the COVID crisis is over.
That's actually something we just wrote a blog post about earlier, or last week actually, on making the most of form design in remotely monitored approach. So we can share the link on the chat. I see another question on involving local networks and community leaders as being key when organizing remote data collection. And the question is, what are the tips for those organizations not having easy access to such networks, especially when, I suppose, you're in a remote context where you can't just knock on doors?
Well, I'll give a very quick response. I think it's networking, because you may know an organization that has someone on the ground and who can then put you in touch with that other organization. So I think it really is a question of networking, asking around, and hoping that you be linked up, which I think it's totally possible. Someone will know this organization and recommend that you work with them.
Maybe a related question. How, and I mean, this has been tackled in different ways during our talk today, but how can you increase community engagement in a crisis like C-19? What are the ways that you can really make sure that you're building that relation and that trust that we've been talking about throughout the whole conversation?
I'd say one simple way is people trust information when it's in a language and a format that they understand and appreciate. I think we, might get too focused sometimes on the exact nature, or the exact words, or the format of the content that we're sharing, and we say, okay, we got to get the message right about hand washing. Sometimes it's more important to make sure that the modality of how we share that is good and accepted. So maybe it's an animation, maybe it's a video, maybe it's using radio more. Really getting creative about formats, especially for populations that have low levels of literacy. If they see a long document written out, it might have the best information ever, but if they can't understand it, it's going to be pointless. So really building that trust through communicating in a language they understand, in a format that they can read and that they can comprehend, is really key for us, and kind of in that first bridge towards trust building.
Yeah, I think also just really having, extending on that, really having that, providing time to give that open dialogue, and not having just an extractive process of we're going in and collecting this data, or we're going in and giving this. Really, even though it is emergency, really giving that time for that back and forth open dialogue, letting people explain what it is they need, what it is they want, and not so much a very targeted, this is the answer we want to this question, really letting people talk about what they want to talk about, and testing their knowledge and, for example, key messages, having that back and forth, and providing time that people feel like they're really, really listened to is really important.
I would add to that also just working together more. I think that we've found this year particularly that it's just so difficult to operate alone now, and that there are so many different ways that you can engage communities and so many different people who are engaging communities. And even if you do decide to do a phone survey, for example, maybe you find a phone survey provider, but you're still going to have to find someone to provide you with the phone numbers or with guidance on how best to do that. And I think increasingly we're seeing that when a lot of these different processes are coming together more, they are becoming much more streamlined and much more effective. And it also means on the community end that people aren't just being slammed with surveys and questions and things over the phone. So I think that to Christina's point about networking, I think that that's kind of more important than ever now. And I think people are really stepping up to that, at least in a few of the situations that we're working in at the moment, which is really nice to see.
Just to add very quickly to that, I would have said something very similar to Mag, but perhaps to add that what we might need to rethink is whether it has to be us who has the direct contact with the end beneficiary, or whether it is not us who makes the Skype call to the local organization that has much better access. And in terms of finding that communication with the local educated people who are all online because they're also all in lockdown, that's totally possible. It is, so I think we need to think much more about these intermediaries and make sure we empower them and use them, well, not use them, but work with them and really let them lead a bit more, and perhaps step away a little bit from thinking that we have to be the ones who do the front line enumerating with the beneficiaries.
I've sort of captured like 5 key ideas from everything you've been saying that we can put also as recommendations. Learning how to take a step back and ensuring that we are not always too focused on one given situation, but also looking beyond. And this also goes back to what Ben Parker was saying this morning, making sure that we're looking just beyond this data collection that we're tackling. The question of being honest in terms of bias and methodological issues that we might have. The question of preparedness, and when such a crisis occurs, there's not much that you can do just like this. You need to think things through and build on what the approaches you've had in the field over time. The question of listening and trusting local communities more than we've sometimes been used to, and challenging this approach as much as possible. And related to that, the idea of ensuring more collaboration and building long-term relationships that will also help build into the trust with local communities, the preparedness, the honesty, and also learning how to take a step back when we need it. So I'm not sure if there's anybody who wants to have a sort of a last, and maybe Claire, you want to say a few words. Is there something that you'd like to highlight from this discussion?
I mean, I'm biased. I would go for collaboration and networking. This really, is my takeaway of this main one of this conversation. And I really like the way we've touched upon learning and working with other sectors as well. And how can we encourage and stimulate cross-sector collaborations? It sounds very common, but we do not do that as often as I might need. So I think, yeah, this would be my final idea. Cross-sector collaborations and ensuring learnings are applied from one sector to another. And hopefully H2H Network and all those network platforms can stimulate and facilitate that.
Yes, and we'll be building something around the conclusions also of this session with the H2H Network and some of all our speakers today and other H2H actors in the coming weeks to try and encapsulate some of the findings that have been discussed today. So I'd really like to thank all of our speakers for the great contributions. I found this really interesting. And if there's any any follow-up discussions, we can definitely have them also in the coming months. I'm sure COVID-19 isn't going to stop right now, unfortunately. And we'll be also sharing maybe some interesting resources from the different speakers, and also guidance or case studies that have been produced or that will be produced in the coming months. So don't hesitate if you're interested on these fronts to reach out. So thanks again, and looking forward to continuing the discussions tomorrow. Hope you're not all too extenuated after today, and that interesting things can also pop up tomorrow during all of the roundtables, workshops, Fail Fest, and I'm sure I've forgotten other formats, networking opportunities. Okay, goodbye.
Bye, thank you.
I see a question on if the recording will be shared. Yes, it will be. It will be shared in the coming days. It'll be up on our YouTube channel. So thank you all, and have a good evening or morning for those who are on the other side of the globe. Bye-bye.